here. And I'm always trying to get the maximal result with a minimal amount of surgery.
Yeah,
that's what I'm trying to do.
I'm very excited to introduce my podcast today with Dr. Arif Tayyab, and he is a orthopedic surgeon, very well trained, and spine specialist. And he went into, my opinion, the hardest field in orthopedics. Spine's tough from the physical and psychological and all kinds of aspects to it. And there are a lot of different options in surgery. And you have to go to somebody who will sit down and talk to you and take a good history, do a great exam, and then give you the best advice. And I've not found anybody, I've had a long career, better than Dr. Tayyab. And I'm very excited that you're going to get to hear what he thinks and how he approaches patients and give you great advice. So even if you don't have the privilege of going to see him at Scripps Hospital in San Diego, that you can take this information and go to your doctor and make sure that you get the best care and you get the outcome that you desire. I'm excited for you to hear him. We'll have other podcasts. Hopefully you'll like and subscribe to them. But this is one special human being. Hi, Arif.
Hey, Kate.
Thank you so much for being here with me. I appreciate it. I know you're super busy and you've got a big practice and very successful. And one of the reasons I started our joint effort is to give people really great orthopedic medical advice. And that's to stop people from having unnecessary procedures, maybe surgeries, maybe they didn't need, but also they might not get resolution of their problem because they didn't get to somebody like you or me. And the other part of this is to interview people who I know are the best in their field. And that's why you're here today, because you're an orthopedic surgeon spine specialist. I'm going to have you talk about that. Spine is very tricky and very difficult, so I admire you going into this field. So first, I'd like you to talk about your field and how you got there. What was your education to get there?
Yeah. The usual as far as, I won't go back to going to the undergrad.
Grade school?
Grade school.
I was born a board lifetime.
That's right. But yeah, but 4 years medical school like everyone. And then with orthopedics, you do a 5-year residency, which I did at the University of Illinois at Chicago. And then for orthopedic surgeons, we generally do a fellowship. Now, back 30 years ago, fellowships were not very common, but nowadays, if you want to specialize further, almost everyone does a fellowship. And so I did my fellowship in Manhattan at the New York Spine Institute at Beth Israel Medical Center. And that was where I really learned about the spine, 100% spine. I lived, breathed, and ate spine for a year.
Why did you pick it? How did you, it's because it's a lot more challenging than other areas in orthopedics.
Yeah. And look, I love orthopedics, and obviously I went through the residency, but I'll tell you, I found spine to be the hardest. And as you said, it's the trickiest. And to be truthful, nothing against orthopedics, I found doing scopes and knee replacements and hip replacements to be boring. And I love them, not so much the scopes, but the hip and knee replacements that I love doing. But there's so much more thinking involved with the spine. You're not just focusing on a joint, which there's one procedure to fix it. And nowadays there's different things to do, but the difficulty of it drew me to it.
Interesting.
Yeah.
And there's a lot of variety in what you do in spine. And talk to us, what are the main things I want people who don't have the privilege of being here where we live and getting to see you is maybe they're 10 states away, to go to somebody really good like you. When you first see a patient, like talk to me about what your process is and what do you first do when you see somebody?
Yeah. I think similar to what you do. I think we see patients in a very similar manner, but number one, you just getting to know someone. Some people are very open to talk. Other people are maybe a little more closed. You just have to look, it could be a serious matter to talk about, but try and lighten the mood a bit, just not make it, I'm a doctor, you're not kind of thing, and make it so we can have a good conversation. And that's why I really try and have a good rapport with my patient. And by that way, you get people to really tell you a lot. Because I think a lot of people go to a doctor and they may say things that they think the doctor wants to hear, or may not tell you very important things that may lead to the correct diagnosis. For instance, maybe they didn't want to report that they fell and tripped down stairs because they were embarrassed by it. So I think if you're able to make people comfortable, put them at ease, you can get a great history. And to treat someone, you have to have the history first. And that means talking and communicating and really getting to know that patient in front of you, even though you just met them. So that's number one. And number two, you have to do a very thorough physical examination, which you do. And I know that personally, seeing you for so many years. But I think nowadays people rely more on the imaging and lab values if you're in that type of field rather than touching the patient, which talking about AI before, AI is extremely important and will make a huge difference in medicine, but nothing changes touch on a patient. Nothing's more important than that. And I'm telling you, and you know this, that you can learn so much from an exam. Even before I look at x-rays or MRI, you can figure things out even before you get to that point. So I think for someone who doesn't live in a place where they have access to top quality healthcare, you want to make sure someone's listening to you, number one. I think if they listen, I think you're seeing a good doctor.
Yeah. One of the many things impressed me about you when I've seen you as a patient, and I know this isn't just me, I know you do this for everybody, but you walk in the room and you sit down like you've got all the time in the world. And I know you don't, but you make people feel like that you make it easy for them to talk to you. And that's part of you learning the history and taking all that, et cetera. And I've seen a lot of doctors. It's a unique quality, but you've got it. And I think that taking that good history, doing that great exam, then leads you to the right diagnosis. Right. Because I know you would agree that you can do the best surgery in the world on the wrong patient and not get the outcome you want.
That's right.
So let's talk about spine surgery is challenging, and some outcomes are better than others, and it has to be undertaken, I think, with a lot of thought. So how do you get to surgery with patients? How do you get to that point? And what do you do before?
A lot of times it takes time. So I'll have people I've known for years before they decide to pull the trigger and get surgery. And these are people who have a problem. And look, you know me, I certainly, unless there's a real problem, I always recommend trying conservative measures first. And because most people, as we know, will get better without needing surgery. That's a fact. And that's where you came in and doing the great therapy. We also know that unfortunately, just going to therapy doesn't mean didn't mean you had good therapy. Oh yeah, I had physical therapy, didn't work. Then you dig in, what do they do with you in therapy? And then you find out that, they just have me in doing exercises and tell me what to do. I frequently ask the question, did anyone put hands on you? No.
Great.
Right. It's shocking. It's shocking to hear that, but unfortunately, that's a sad truth. Then I said, unfortunately, that's not good therapy. But I find nowadays that people don't get good therapy, even if you send them to a quote unquote good place. It's just the way they've gone down a bad road. And it's more having an aide see people and the therapist is actually not really helping them for whatever reason. And that's a shame, because I feel that a lot of people I do surgery on might have gotten better had they had access to good therapy. That being said, they have to have the will to do the therapy, the motivation to do it. But getting someone to surgery, there's some people you meet who are in so much pain and they have the problem that I know surgery can make better. And then in those cases, I will offer surgery as even a first option if people have pain for a long time. And a lot of people who are in pain like that will go for it. And now there's others who really want it, even though they're in pain, they'll try anything before they do surgery. And I support that, as long as it's nothing that's crazy. I'll say, look, as long as I think it's a reasonable treatment, I'm okay if you try it. Now, if you tell me you're doing something a little off the wall, I'll let you know. But if you can live with the pain, you want to try this out, I don't have a problem with that. And I think that then you build that relationship of trust that, because nowadays, a lot of people, you go and see the surgeon, all they want to do is cut on you. That's all they want to do. I get a little offended by that, because that's not true. But it is true. There are some people who just want to cut first and ask questions later. And I don't think that's the right way to go. And that's not the way I was trained.
Yeah, that's what makes you so good. I want to go back to one thing you said, and I feel badly for you as a surgeon when you do the right thing and you send them to therapy and they really don't have therapy. They go do this and go to that and they come back. How do you make an educated decision about what to do next, because you know that they didn't have what you wanted them to have.
That's right.
It's difficult.
It's difficult. Now, if they have a problem, which I know they're not, that I'm not really keen on operating on, I'm just going to let them know. I tell them up front, look, I'm sorry, but this is not, you don't have a condition that surgery will be helpful in treating. I'm very honest about that. And I'll say, look, this is my opinion. You're happy to get another opinion, but I'm very upfront about that. And I said, so we need to get this better without surgery. So whether if it's not therapy, try acupuncture, try nothing. I'm not a huge chiropractic fan, but just try anything to try and get this better that's reasonable. And if not, try injections. But I'm very upfront about that. And I think they appreciate that. Now, when people are in pain, sometimes people can be a little upset, but you have to be honest. And because if you don't tell them that up front, that does lead to you doing surgery on people who are not going to get better, which leads to bad outcomes and that's the worst. When it comes to spine surgery, having a bad outcome is going to follow you for a long time, because those patients they're not happy people, and then it's harder to get them better because you did a surgery that you shouldn't have done in the first place. And I see this, some people who had surgery, and I'm thinking, my gosh, they shouldn't have had this. It should have never been offered, but it was. And then it's too late.
It's tough to fix something after the fact.
Tough to fix. Yeah.
That's another thing I appreciate, and what makes you such a good doctor is you always do the right thing, and you don't rush into things, and you really evaluate and analyze it and make sure that you're making the best decision for that person. And I hear stories all the time. What, did you go see the doctor? I saw the PA. I go, well, did you ever see the doctor? No, a little different.
Yeah.
One of the things that we've experienced together is that you're an athlete and you tore your ACL. And I got to be involved in your first surgery, and then did your rehab after, and then you came in and trained with me and got stronger, and then you tore your other ACL.
Yeah, I'm a glad for punishment.
And then we got to do your rehab and your training after that. So I got to see you through many years of that.
Yes.
And you worked very hard. Oh my gosh, the hardest ever. He was a sweaty mess after every training. In fact, I think the shower in our clinic was there installed just for him. That's all. Just him. But as going through that, and you then were not the surgeon, you were the patient.
Yes.
And so going through that, did that affect how you see patients or empathize with them, or did that change anything for you in terms of your outlook and what you do professionally?
Sure. I think the number one part is it's not just going through the surgery, which I knew what I was getting into as far as ACL reconstruction, both, but it's more the rehab, because in training, you don't see that. You follow people, but you don't see how much work it takes to get better. Or if you're watching on TV, an athlete will tear an ACL and then magically 6-8 months later, they're out there like nothing ever happened. And then sometimes they'll show what the athletes are doing to really how hard they're working, but you don't know until you go through it. And I'm telling you, it's tough to get back, get the proprioception working, get your muscle strength back. And in my case, as you remember, my core strength was a 0. I remember sort of vividly. Here I am coming in thinking I'm in great shape, and then I remember you had me. I think it was, I don't know, it wasn't a plank, but I think it was a one-legged something, and I couldn't do it. And it was embarrassing. Here I am. I was really embarrassed, and I thought, this is terrible. And talking about my core strength now, and so I'll tell you that even though tearing ACL is not something you want to do, probably the best thing ever happened to me.
Yeah, you're in phenomenal shape. It's
I am now.
Work so hard
because of you.
I like that you take that and you then now know what your patients have to go through. Spine rehab's not easy either, and even more challenging, I think, just because the spine is so difficult.
I will say that the second ACL was not really necessary. Then I already knew what I was getting into. So I didn't have to, the second ACL was not something I had to have happen in my life. The first was enough, but the second was actually went a lot smoother because I was in a lot better shape as far as my core.
Yeah,
and everything else.
For sure. See? People need to, the prehab part is really important.
It was easier. Second time was easier. First time, and I was older, obviously a lot older, but it went a lot easier because I was already in great shape beforehand. Yeah.
And you start training much sooner after the second and at a higher level than you did at the first, for sure.
I'm doing more today than I did 20 years ago as far as my level of, I got back into tennis now, playing. I'm doing everything at the level I need to be.
And are your knees fine? Are you
My knees are great.
no complaints?
No
You
complaints.
can feel like you can do
Yeah.
any
Oh, yeah.
activity you want without any limits?
I'm doing everything I want to do.
Nice.
Yeah, the knees do not stop me. That's for
Okay,
sure.
good.
Yeah. Neither one.
Good. I'm
Yeah.
happy about that.
Yeah.
So we're hoping that people far away will benefit from your advice.
Yeah.
So if somebody was out there and they were saying, gosh, my back has been bothering me long enough now, I need to do something about it. If they had to go see somebody, what would be the few things that you would tell them to look for
Sure.
to find somebody really good in their area? How would they do that?
Yeah. I still think, I know everyone's online and everyone looks at reviews and all that, which is good. That's a good way to look at things. I still think word of mouth is still important. I think you have a friend or family member who went to see someone who they're very happy with. That's still a great way to, I think, probably the best way to get to see a good doctor, regardless of what field they're in. So I still think that's very important, even though I know everyone's internet is important too. But it's not who has the best website and how many I do with 500 surgeries a year and all this kind of stuff. It really is more, what are they going to offer you in terms of, number one, a great evaluation, because without that you have nothing. You have to establish a diagnosis, and then outside of doing surgery, what other things can be done to help you out? And yes, I am a surgeon, but we know that less than 10% of people, that's even a high number, really need surgery for these back conditions. And most people will get better with appropriate non-operative care. When you go to someone who's doing all these surgeries, I think you need to think about that and say to yourself, okay, either they're just so busy and they see all these people who need surgery, or they're just doing a lot of surgery and maybe they're doing too much and maybe they're not being very selective in who they operate on. I think you can find patients of people who've gone and had surgery with people, they'd be good to talk to as well, because it's not just a surgery, but how are you treated after the surgery? It's not a wham bam thank you ma'am where you do the surgery and that's it. There's a post-op course that you need to follow people and make sure everyone's doing well, and if not, you have to react to that. And so you need someone who's going to be invested in your care from before the surgery to until you're doing well, which for me, I usually follow people for a full year after the surgery and then yearly after that, to make sure people are doing well.
Good. That's nice.
No.
I just know, as seeing you as a patient, I always felt you were going to take care of me, good, bad, or ugly, no matter what. And you always gave me the best advice. Is there anything in your field now that's changed over the last few years for the better, or cutting edge, or things that maybe weren't available before that are now, that maybe people not in as progressive areas as you are in that maybe should know about?
Sure. So look, when I trained in what's called open surgery. We were making big incisions and putting screws in. That's the way I trained. And about, I think 2016, I got more involved in more minimally invasive surgery, which has really changed my practice for the better. Shorter OR time, less blood loss. That's allowed me to operate on people who may not be as in good of health, because I'm not losing as much blood. They're not having as much anesthesia. So I think someone who does minimally invasive surgery, I don't want to get to it, because just doing that doesn't mean anything to me, because in the end, whether you do open surgery or minimally invasive surgery, the outcomes are essentially the same. But minimally invasive surgery, people do feel better faster. And if you do get the same outcome and you feel better faster, then why not do it? And so that's something that I evolved into just by learning. That's nothing I trained on. I had to learn that in practice, which you do the same thing. You have to evolve with what's happening in your field. If you don't, you're left behind in the dust. And I know people who are doing the surgery exactly the same way they did 30 years ago, which to me is, okay, I know they get great results, but you can do things a little bit differently and still get a great result, but they just don't want to change their ways, which I think is not a great way to go. So I've changed my whole practice, which I think for the better based on doing that. Nowadays, getting the robotics, I think that's going to be important as well, but that's not the be all end all. I think, but you want to see someone who, I think, number one, has a good reputation, either online or by, I think more importantly, by word of mouth. I think minimally invasive surgery, I think it's not just, it is a catchphrase, but it is important in today's world, because a lot of people will do better with invasive surgery. Disc replacements, I think, they've been around for a long time, but have really taken off, especially in the neck, which I'm doing quite a lot of nowadays. Low back even now too. So these are things I think you want to look for in a surgeon. I think we need to see someone who does these things, and then Then after that, you want to know how much they do, right? Because then you don't want to go to someone who has done 5 or 1, and you want to go to someone who's been around for a while and done more. And I know everyone has to start off at some point, but you want to go to someone who's a little more experienced in that regard. Yeah.
I'm glad you mentioned artificial disc, because so many people, because of being active, have degenerative disc disease. And prior to that, there wasn't a whole lot of what you could do to increase that joint space. And I know you've been doing a lot in the neck. And so now, the results for your low back, are they as good, or is that as common?
I think the low back, to me, is trickier than the neck, because with the neck, you're generally not dealing with any kind of instability. And that's why the artificial discs in the neck work so well. The low back, a lot of people I operate on, and you're with this firsthand, have slips to their back, and you have instability. And those are people who traditionally have not done very well with disc replacements. They need the fusion, which, look, the fusion is still a great surgery in the right person. But it's funny, over my course of my career, I feel bad fusing people at this point. I really don't want to, which is why this is the field I'm in. But if I can do something else not to fuse them, that's what I'd like to do. Whether it's a smaller surgery, just a decompression versus a disc replacement. That being said, the fusion is still important for these slips that a lot of people will get as they get older. And right now, the disc replacer is not the best option for that, because that can fail very easily. But I think I think you want to go to a surgeon who's open-minded to these new approaches and not doing exactly what they did with 30 years ago, which I find that, and know these people.
Yeah, exactly. Or they do a huge surgery where a little surgery could have.
That too. That's exactly right. And I'm always trying to get the maximal result with a minimal amount of surgery. That's what I'm trying to do.
That's a great point. Do artificial disc replacements last a lifetime?
As far as the literature shows now, the answer is yes. It doesn't have the wear that hips and knees have. So we don't have data going out 30, 40 years, but 15, 20-year data is showing that to be true. So it doesn't wear out like what we're seeing. So the answer is yes.
Great.
They are working very well, and they're the right people. Yeah.
I had a friend who has hardly any, very minimal symptoms, went to a surgeon in another state, and first thing, and no instability. And he said, "Oh, we need to do fusion." And I'm like, "Oh, no." Yeah. But is one of the challenges with the fusion, if you fuse a joint, that a lot of times patients have problems with above and below that?
Yes.
Is that part of the...
Absolutely. And that's why fusions, even though that's what I do and I trained on it and they work, but it bothers me, because we know that at 10 years, the data shows 30% of people need more surgery. That's a lot of people. And to me, it's really unacceptable, but that's just the way it is. And you can't blame that only on the fusion, because then you have to think to yourself why that person needs surgery in the first place, as opposed to most people don't. So there are some biological causes and even genetic reasons why, but the fusion itself does change the biomechanics of the spine, and it does put more stress on the level above and below. And so it's always bothered me. And as I gotten older, it bothers me more, to tell you truthful. And then, so I think it's all, I'm going to work and I love what I do, but I do fusions and gosh, I almost feel guilty doing them nowadays. It's really that I'm at that point, which is weird to say, because this is what I do, is in my work.
In good faith that they may have a significant number are going to have problems, and then you also know that maybe there's a better option if you're not unstable.
And that's why I try and find, if I can do the better option, I'll do that. And again, and with what we know now, in 20 years from now, I'll probably look back and say, my God, I can't believe we did it that way. But it's, for these certain conditions, it's still the best option until we find something better, which we're always working on.
It's kind of all those years ago when you had a little meniscus tear, they took the whole thing out. When did that ever sound like a good idea to have bone on bone?
Oh, you just cringe when you hear it. And I even back in my training, I had one guy who still did that, and I just cringe when I think about it. It makes no sense.
Biomechanical sense.
It makes no sense at all. None.
I don't know why how that was a good idea.
I don't know.
Is there anything, just to wrap it up, that you feel people who are having problems with their neck or their back really need to know that you haven't already talked about, there's so many people that aren't going to be able to walk in your door, unfortunately. And so is there anything you want to tell the people out there in the world because the whole goal of this, our joint effort, is give people the best advice so they get the right treatment, they get to the right person, and they get the outcome that they desire, is there anything that you want to tell people that to make sure they get that?
Sure. When I say, even if you're not, let's say you're a small, look, we're both from Illinois. I grew up in a small town, Illinois. Now, that being said, there's a lot of healthcare where I grew up now, and it's become a big kind of healthcare town. But if you don't have access, let's say you're even in a smaller town outside of where I grew up, having access to the internet and being able to look on things up online is a great benefit nowadays. You didn't have that 30, 40 years ago where you just didn't have it. Now you can. And so you can look at the forum like this and get all this information. And then you can branch out from there. Or get involved with people who had prior surgery, get involved in chat groups or forums just to get an idea of what other people have done. As I said, also, if you're at the point you need to see a doctor, you can search online. I think that's a good way to go, because then at least you have an idea of who's out there, who's doing what, and especially if you're in the area you're in. And then from there, you can start talking to people or just trying to figure out, does the person have a good reputation? And if you know someone who's had surgery, how their outcomes are, and how the post-op care was, and things of that nature. So nowadays, there's no reason to live in isolation. You really have access to so much, and you doing what you're doing with this is a great way to do that. And this is giving people a lot of good advice on what to do moving forward. So I think you just communicate and do some investigation on your own. Be proactive, and that's a good way, because you're in charge of your health. And I don't mind people come in. I have plenty of people, young people coming in. ChatGPT told me that this was my diagnosis. And actually, the other day I said, you know what? ChatGPT might be right. I think they're onto something here. And and the younger crowd now, this is a guy in his late 20s, early 30s. This is what they're looking at, and why not? I look at it too. But I think you still, AI is one thing, but still you have to meet with someone, person to person, the physical contact, talking to people, because AI can't recreate that. It's helpful, but it's not going to recreate that. But I think now, again, as I said, nowadays there's so many options out there to take charge of your health, and I think that's what you have to really do. And I'm not a big doctor person myself, but I still know who I would go to if I have a problem, and I have things in place for that. And as I'm getting older, I'm getting better with it. I'll say that. And when it came to therapy, I knew exactly where to go, and that you changed my life that regard.
That's right. It was a really privilege. You did everything I asked of you and more.
Yeah.
Is there a really great spine surgeon group, or that maybe people like you?
Yeah.
I know there's the AAOS, but is there a site that people could go to?
The North American Spine Society, I think, is a very good site to go to. As far as that's a lot of information there for patients to look at. The AAOS is not as good for spine. It's more geared towards the joint replacements and sports medicine. But the North American Spine Society is a very good resource for patients.
And as you said, I just want to reiterate, you have to be your best advocate.
You have to be. I agree.
You can't rely on just, I went to the doctor, they said this, I'm just going to do this. They said, if I don't jump off the Coronado Bridge, I'm going to be all better.
That's right.
You have to be involved in your care.
Right. And I love when people come in and they've already looked at things, and I love it. And then I'll tell them, I said, look, I think yes. Then I'll say, no, I don't know about that. And we can have a little conversation. But I think it's great. I'd much rather do that than, okay, you have this, okay, do this, okay. Okay, I'm giving good advice, but I'd rather have someone who's a little more kind of proactive. And although everyone's different, so some people are just not going to do that. But yeah.
I can't thank you enough for this information. The spine is tough. God love you for going into this field, and they have to be really smart about what they do. And if one of the main things, besides you being such a good diagnostician and technically so good and always doing the right thing, is the thing that sets you apart from a lot of people, and I want people out there to find somebody like you, is that you really care. You really care about your patients, and you care about them. You said it earlier. You want them to be able to get out of this pain or whatever is bothering them, or maybe it's a immobility, that they can then go on to do the activities they want to do in their life. And whether it's play tennis or play with their grandkids, you want to make sure that they get there. And that does set you apart. I will tell you, you may not admit it, but it does. And so I wanted people to know there are really great doctors out there, really great surgeons who really care and are technically good. And maybe this will inspire a bunch of questions and people ask us, and maybe we'll get a chance to refer them to some other people around the country or beyond.
Yeah.
But I can't thank you enough for sharing all this information, because this is a tough topic.
Yeah.
And it's, in my experience, and I've had way too many years of experience, that it's the reason you're here talking to me is because you are the best that I have found, and for so many reasons. So
Well, that's very humbling. Thank you. Number
No,
one. Coming from you,
it's true.
very humbling. Yes.
It's true.
Yeah.
So thank you. I know you're super busy, and I'm so happy to see you and to have this important conversation for people.
Yeah.
Oh, thanks.
Oh, I'd be here for you. I don't think twice about that.
Oh, you're really sweet.
Yeah.
If you like this episode as much as I did, please make sure that you hit the like button and be sure to subscribe. It's free.